Assalamualaikum and a very good day to our beloved lecturer Dr. Dila Sadia. My name is Nur Iffa Aqilah binti Ibrahim, and as for this presentation, my team that includes Nur Syafiqah binti Mohamed Yazid, Sofea Amirah binti Sarifulbahari, and also Syahira binti Mat Saleh, we will be presenting regarding chapter 18 entitled Symptoms, Signs and Abnormal Clinical and Laboratory Findings Not Elsewhere Classified, which the codes are included from R00 to R99. So without further ado, I'll start this presentation. So let's get started. First and foremost, what do we really actually understand regarding symptoms and sign? So basically, symptoms are something that is describing anything that is related to the patient's or person's body, while sign is that something describing anything that is related to the disease or condition. So, under the use of symptoms code, it is actually codes that explain symptoms and signs that are accepted for the purpose of reporting when a related definitive diagnosis has not yet been established or so-called confirmed by the provider. Under the use of symptom code with a definitive diagnosis code, basically here it says that sign and symptom are coded until such further confirmation, which is as long as the code has no related with the previous disease, and as for example, various signs and symptoms associated with complex syndromes. So here, the definitive diagnosis code should be sequenced first and then followed by the symptom code. As for the next point, this presentation will be continued by Sofea Amirah, and without further ado, I would like to pass this presentation to her. Thank you.
Thank you, Iffa. Assalamualaikum warahmatullahi wabarakatuh. My name is Sofea Amirah binti Sarifulbahari. Next, I will present about repeated falls. Repeated fall, code R29.C. Repeated fall is for use for encounters when a patient has recently fallen and the reason for the fall is being investigated. Next is a code Z91.81. History of falling is for use when a patient has fallen in the past and it has a risk for a future falls. When appropriate, both codes R29.6 and Z91.81 may be assigned together. Combination codes that include symptoms. ICD-10-CM contains a number of combination codes identify both definitive diagnosis and common symptoms of the diagnosis. When using one of these combination codes, additional codes should not be assigned for the symptoms.
Okay, hi, Assalamualaikum, my name is Syahira. So I will present about the Systemic Inflammatory Response Syndrome, SIRS, due to non-infectious process, which is it can develop as a result of the certain non-infectious disease process, which is trauma, malignant neoplasm or pancreatitis. Okay, we have a 4 conditions. The first one is when SIRS documented with a non-infectious condition and no subsequent infection is documented, code for the underlying condition should be assigned, followed by R65.10 of a non-infectious origin without acute organ dysfunction, or the other is code for R65.11 of a non-infectious origin with acute organ dysfunction. Another condition is if an associated acute organ dysfunction is documented, appropriate code for the specified type of the organ dysfunction should be assigned in addition to code R65.11. And another condition is if acute organ dysfunction is documented but cannot be determined if the acute organ dysfunction associated with SIRS or due to another condition, provider should be queried.
Hi, my name is Nur Syafiqah binti Mohamed Yazid. I'm going to present about coma scale, which is the code is R40.2. So this code can be used in conjunction with traumatic brain injury code. The coma scale code should be sequenced after the diagnosis code. one from subcategory needed to complete the scale. The seventh character indicates when the scale was recorded and should match for all three codes. Assign code R40.24, which is the Glasgow Coma Scale, total score, when only the total score is documented in medical records and not individual records. Do not report codes for individual or total Glasgow Coma Scale scores for patient with medically induced coma or sedated patient. Move to the next slide, which is NIHSS. It stands for National Institutes Health Stroke Scale. The code is R29.7, can be used in conjunction with Acute Stroke Scale, which is I63 for the code. This is to identify the patient's neurological status and the severity of stroke. The stroke scale codes should be assigned or sequenced after acute stroke diagnosis code. Thank you.
Okay, the next is a death not otherwise specified. We will code R99, which is a defined and unknown cause of a mortality, only for use in a very limited circumstances when a patient already died, brought into an emergency department or other healthcare facility, and pronounced death upon arrival. It does not represent the discharge dispositions of death.